Acid reflux is a common condition that is usually controlled by medication. But when symptoms are severe, including refluxing even when sitting up, and they are not being controlled with medication, surgery should be considered. A normal esophagus should reach 2 to 4 centimeters below the diaphragm so that positive pressure in the abdomen compresses on the lower esophagus and prevents reflux. When reflux occurs, there is not enough length of the esophagus below the diaphragm so that positive pressure on the stomach tends to push things up, refluxing into the esophagus. Hiatal hernia is a situation where there is laxity of the opening between the chest and the abdomen, which allows a portion of the stomach or other organs to go up or herniate up into the chest. During surgery for reflux or for a hiatal hernia, laparoscopically, the herniating part of the stomach is brought back into the abdominal cavity. Dissections of the attachment to the esophagus is done to allow 2 to 4 centimeters of esophagus to be brought back into the abdominal cavity. The lax opening or hiatus is then brought together and sutured, closing this snugly around the esophagus. The connection between the stomach and the spleen is divided, allowing the top part of the stomach to be mobilized. This is then brought around and wrapped around the lower end of the esophagus. Creating a valve called a fundoplication. This valve prevents the refluxing of material up from the stomach into the esophagus.